Why should the state not accept the Medicaid option that's being offered?
The expansion.
Yes.
The answer is simple. A, it will actually cost us, even though it looks on paper like it's a good deal, it is a very bad deal. And more important, frankly, it's bad for patients.
Why is it a bad deal economically?
It's a bad deal economically because they are massively expanding, effectively, government welfare, and they're putting the burden of all of that bureaucracy on our state, but our patients, our people, are not getting any more care. Indeed, they're getting less care. So it's forcing us to accept increased eligibility requirements, age, categories, and so forth, 400% of poverty level. That's 79% of the entire nation would be covered by the federal expansion of Medicaid. That would be financially devastating to our country, our state, as well as.
But the advocates say, hey, the federal government's going to pick up 80-90% of the tab.
Well, they are. Where's the money coming from? Okay, let's say that they fulfill their promises, which, by the way, I have questions about, and God knows their estimates of cost have been off, as Paul was pointing out, by 800, 1,000%. In Medicare, it was 854%. My point is that there is no free money. If they say, oh, well, it's the Fed's money and it's free money, it's not free money. Where's it coming from? Ultimately, we have to pay the debt of the money they're printing.
And the state might be left on the hook after 5-10 years?
5 years from now, we can't then reduce the eligibility requirements. That would be against the law. And yet, if the money's not there, New Mexico is going to have to pay for it.
You're against the ACA, the Affordable Health Care Act.
I am.
The Supreme Court said it's constitutional, so
Yes.
How can it be dismantled, if at all?
Oh, dismantling it, firstly, all it said was it can fit constitutional requirements. I personally have questions about that, but the Supreme Court is supreme. Having said that, you could defund it tomorrow by saying, well, yeah, there may be an independent payment board, but we're not paying them to do all these studies and give us recommendations for what we should pay for and what we shouldn't pay for. You defund it and suddenly it disappears.
So why should ACA not be the law of the land in your mind?
Because ACA is bad for patients for sure. It is expanding the bureaucracy while cutting services and money money is services to patients, so it's bad for patients. It's bad for our country. It's going to cost anywhere from $1 to $2.7 trillion of money we don't have. And what it's doing is it's increasing the bureaucracy and complexity, which is exactly what is killing healthcare in our country, is the burden of all these regulations, all this complex bureaucracy, and it's making many people, me included, say, I've had enough and quit medicine. Not to mention the people who are saying, well, I'm not going into that. If it's that painful to do what I think is really a wonderful thing. I love taking care of patients. So I love my work content, but the work environment, and I don't mean the university, I mean healthcare is truly a stressor and a pain for nurses and doctors and other providers.
If the Health Care Act goes into effect, isn't there going to be a shortage of doctors?
There already is a shortage. All it will do is greatly magnify the shortage. So you might even have, one person, might even have insurance under Medicare, Medicaid, whatever you want to call it, through an exchange, but you're not going to find a doctor. So that's one of the reasons, if not the primary reason, why I'm opposed to the ACA, is that the government claimed that you can, if you like your doctor, you can keep your doctor. Well, the fact is, your doctor's going to be out of business, and oh, by the way, he can't afford to take you if he's still in business because the payment schedule is so low. And oh, by the way, there are only 6 doctors to care for 100,000 or 200,000 people, whatever. And so even if he wants to care for you, he can't put you on the list. So the shortage is going to be critical.
People on the left say healthcare is a right. What do you say to them?
I say if it's a right, that means that A, it's free, and B, that makes me a slave. Because in order for somebody to have a right, it means somebody has to provide care, deliver service. Well, what if I don't want to? Then what good is somebody's right to health care? Because health care is a service. It's not the right to life, liberty. Those, if you really look at, and I did this for my latest book, if you look at the Bill of Rights, the foundation of our nation, they're all negative. By negative, I don't mean they're bad. I mean they are constraints against government. They are not entitlements to the people. You have the right to speak freely. You have the right to congregate. That means the government can't stop you from talking, and the government can't stop you from congregating. It doesn't mean that you have the right to a computer so you can blog whatever you want.
Deane Waldman, thank you very much for your time.